Hi there, my name's Jenny Eales. I work for the Urgent Assessment and Home Treatment team in Hampshire CAMHS. Today I'm going to be talking about working with young people when they are in crisis. So today I'm going to be talking about some of the signs and symptoms that we might see when a young person is in crisis, and what we might be able to do to improve our communication with young people who are in crisis, and some ideas about some practical things that you can do if you come across a young person who is in a mental health crisis. What do we mean by a crisis? Any one of us may have found ourselves in some sort of crisis at some point in our lives. So one of the things that we may find is that there's been times in our lives when the things that are happening to us push us into this sense of feeling out of control. And this can be thought of as a crisis. And whether or not that crisis becomes what we would think of as a mental health crisis depends on a few different things. So it depends on how long that sense of being out of control lasts. It depends on how strongly we are feeling the emotions that are leading us to feel out of control. And it also depends a little bit on what behaviours we might be doing to try and get ourselves to feel like we're back in control. So many of us will have had times when we have been able to move ourselves back into a sense of feeling that we're okay, that the crisis has passed. But if someone's really struggling to do that, that's when they may need further intervention. So the way we're going to talk about crisis is by using what we call the zones of regulation. So as you can see on this slide, there is a big wiggly line, and then there are two parallel lines that wiggly line is going through. And those two parallel lines, whatever emotion someone is feeling between those parallel lines, feels like it's in their window of tolerance. They feel like they can manage that emotion. So it's not that they are emotionless, it's just that they are experiencing an emotion that they can manage. And that window of tolerance can be affected by lots of different things. So it can be affected by whether or not someone has slept well. So if you're anything like me, if you haven't had a great night's sleep, that window of tolerance starts to get squeezed, and we're more likely to feel like our emotions have gone outside of what we can tolerate. More likely to feel irritable, more likely to feel anxious about things if we haven't slept well. So that window of tolerance can be affected by all sorts of different things, by whether we've been taking substances, by whether we have had some nice time with family or friends, whether or not we have ongoing stress in our lives. So one part of the thing that we're doing when we're working with people in crisis is trying to shore up that window of tolerance to make it as big as possible. So that person can manage the emotions that they are experiencing. Now, as you can see on that diagram, there are times when that pops out of the top. The wiggly line goes up and then comes back in. And this would be a time where someone was feeling that they were kind of like really losing control in that kind of hyper-stimulated way. So these tend to be emotions such as anger, anxiety. They tend to be those pacey types emotions that people feel like they need to calm down from. They're not quite sure what to do with themselves. So sometimes people can be out of the top of their window of tolerance, and then other times, as you can see on the diagram, people come out of the bottom of their window of tolerance. And when people come out at the bottom of their window of tolerance, they're much more likely to be feeling numb, helpless, hopeless, doing very little, finding it really hard to activate themselves and feel motivated for things. So when we're thinking about someone who is in crisis, not only are we trying to shore up that window of tolerance, but we're trying to help them get back into that window of tolerance, either by down-regulating their emotions and dealing with their distress, or up-regulating their emotions back into that window of tolerance and getting them to feel things and be engaged again. So we're moving on to thinking about what this might look like in everyday life. So this slide here is telling us about what it might look like maybe for me on an average day. So as you can see, most of the time my emotions stay within that window of tolerance, but that doesn't mean I don't have moments where I'm feeling hyperstimulated or understimulated. So the first time when it pops out at the top, it might be, for instance, when I'm trying to get the kids to school in the morning and I feel like I'm really running out of time. I might start to get a bit frantic, a bit irritable, a bit less able to think around the things that I need to be doing. And then my day goes on, I'm relatively well regulated, so those emotions come back down into my window of tolerance. But then maybe, as you can see, I go under for a little bit. This might be, say, I get an email saying that the money that I have applied for this amazing project that I think I want to do has been declined. And so I drop into this understimulated. I might be kind of having thoughts like, gosh, what was the point of all that work? No one believes in what I'm trying to do. But because I'm relatively well regulated, I might talk to one of my colleagues and they might help me and say, it wasn't all wasted work. We can look at other ways of doing things. And hey presto, I'm back up into that window of tolerance. And so it goes on throughout the day. And so the idea that going out of your window of tolerance is somehow problematic on a day-to-day basis is not what we're talking about when we're thinking about crisis. So this next graph is what we might see if someone was in a crisis. So as you can see, this is a crisis where someone is very out of the top of their window of tolerance. They're feeling overstimulated, they're feeling maybe irritable, angry, anxious. Could be lots of different feelings that they're feeling. And as you can see, it's really difficult for that person to spend any time in that window of tolerance. So even though they may have ways of dealing with how they're feeling and they may come back into their window of tolerance for a time, they quickly bounce back out again. And at those points, they are feeling out of control again. So when we've got a picture where someone is finding it really difficult to get back into that window of tolerance, when they're spending very little time in that window of tolerance for an extended period of time, for maybe a few days, a week or more, then that's when we might start thinking that this person is in a mental health crisis. So what might we see if a young person has gone into one of these mental health crises? So there are several things that we might notice. So the first is that we might notice self-harm. So we see self-harm as an attempt to re-regulate. So someone is out of the top or out of their bottom of window of tolerance and they really want to get back in there. That's where, as human beings, we like to be. And for some people, they find that when they have harmed themselves, that they get a sense of calm, that they get a sense of perspective, that maybe some of the negative thinking that they've had stops. And that's why some people might use self-harm to try and re-regulate themselves. Of course, self-harm comes with other problems and it is, of course, harmful to the person. So we're always looking for alternatives for that person to re-regulate. Another thing that might happen is that person may express suicidal thoughts. So when someone is in a crisis, they are either going to want to re-regulate or they're going to start thinking that they need to escape this crisis. And people might escape that crisis by thinking about the fact that maybe they shouldn't be here anymore, that if they weren't here, they wouldn't be dealing with this situation. So there can be all sorts of things that lead to that suicidal thinking. So having a problem that the person doesn't think that can be solved, maybe a problem that they've been trying to deal with for a really long time and haven't managed to make any difference with. It might be something like feeling ashamed of a part of themselves and fearful of people finding out about this part of themselves. Alongside this, being out of our window of tolerance comes with some specific difficulties. So we're likely to find it very hard to communicate. So when we're in a crisis, our brains are either flooded with stress hormone, which affects our ability to think and to communicate, or sometimes it can be kind of in a bit more of a shutdown, which also affects our ability to communicate with other people and to think through things. So when someone's in a crisis, we might see that they feel like they can't really explain what's going on. They might be saying that they aren't able to think things through. And this is really difficult because actually some of the things we need to be able to do when we're in a crisis is to communicate and problem solve. So some of the work we do is to try and bring people down into the window of tolerance enough for them to be able to communicate and to problem solve effectively. So I'm going to take you through what we call a coping and resilience plan. So this is something that you can put together with a young person to think about practical ways in which they can deal with how they're feeling and the things that are going on when they are in a crisis. So the coping part is about getting back into that window of tolerance. So ways in which that this young person can practice and use to feel like they're regulated again when they're feeling overwhelmed. The resilience part is all about trying to make that window of tolerance as big as possible so that once that young person has re-regulated, they're less likely to pop out of the top. And on the coping and resilience plan, we have lots of different sections, and we're going to go through those sections one at a time. So the first section on this coping and resilience plan is about what that person's able to do when they really feel like they're regulated and coping. So what is there in their life? And so they tend to be similar types of things. So we call these the ways of well-being. And they're things that all human beings need to feel like they are safe and feel like their mental health is in a good place. So one of the things is being connected to other people, not being kind of alone for long periods of time, not feeling like they don't belong anywhere. So on this plan, we've got the being connected to other people. Activity is really, really important as well. A reason to move every day. So it doesn't need to be high levels of exercise. It doesn't need to be training for the next marathon. But it does need to be a reason to move every day. Rather than sitting in one place for long periods of time, never getting outside. Those sorts of things are going to negatively impact that person's mental health and their window of tolerance. There are other things that can help with that feeling of coping. So those basic kind of things that all of us need as human beings: good sleep, good eating, making sure that we're treating physical illnesses that we might have, making sure that we're not kind of being dysregulated through the use of drugs and alcohol. So just thinking about those core things that we all need as human beings to keep us well. And then we might think about that looking outside of ourselves. So we know that if we spend a lot of time looking inward, we are likely to find a lot of problems. We're likely to find a lot of things we don't like and to begin to think very negatively about ourselves and the world that we live in. So using things that give an outside focus, a focus on other people, a focus on the world around us can be really helpful. And this is where the part of this coping plan that talks about doing things for other people, doing something nice to support someone else, it takes the focus from the inside to the outside and therefore away from repetitive, ruminating, kind of negative thinking. The other thing is to think about gratitude. That can be really helpful for feeling like you're coping and that you have good resilience. So noticing just small things that come up every day that are okay, that have been all right, that haven't been part of that negative cycle that the young person has come into. So we have to treat these things quite lightly. We don't want messages such as you need to stop thinking about yourself, or you're being selfish, or you need to see how good the world is, because we all get into these patterns. It's a natural way of our brains to be, and we have to practice to be able to look outside of ourselves and see other things that we might appreciate about our lives. And then we've got the part of this coping and resilience plan that's written on the blue section. So this is starting to think about what might tell us that things are becoming difficult for this young person. What are the early warning signs that we might be looking out for? And unsurprisingly, they tend to be the loss of some of those ways of well-being. So staying a lot longer in the bedroom, not having contact with people, maybe sleeping badly, or finding it really hard to get out of bed to get to school on time, avoiding things that usually that person would do. There may be things around starting to become hypervigilant, trying to work out what's wrong, and this can lead to things like lots of scrolling through the internet, lots of scrolling through social media in this kind of anxious state of working out kind of what's wrong, that because that person is hypervigilant, they're starting to look around them to see where the threat is. So then we're moving down our coping and resilience plan, and we're thinking about triggers. So when we think about triggers, we're not necessarily thinking about something that is complete cause and effect. And as you can see on this coping plan, the things that are there are very ordinary things that young people will be coming across in their everyday lives. So triggers don't have to be big things. They don't have to relate to traumatic experiences. They're just events that happen that prompt a way of feeling and thinking. And the most important bit is what the thinking and feeling is that's been prompted. So rather than thinking, this trigger happened and so I self-harmed, we're thinking, this thing happened, I felt this way about that thing that happened. I had an urge to feel differently, and so I self-harmed. So we're just wanting to break things down a little bit more into these sections, rather than jumping from, I had an argument with my friends, and so I self-harmed. So these things, sort of like arguing with friends, exam stress, looking into the future and feeling a bit hopeless about what's going to come next. These are all very, very common prompting events for young people to feel like they're heading towards a crisis. Moving on to the bright yellow and the purple section of the coping and resilience plan, we can see that we can work with young people to think about safety, to think about what might be the environment, the things that happen that either increase that urge to self-harm and make it less safe for that person, or decrease that feeling of an urge to self-harm. And for this young person, they were able to identify that if they're starting to feel overwhelmed, if they're starting to feel like they're not managing very well, that it's not very helpful for them to have access to things that they could hurt themselves with. So of course, a young person could hurt themselves with anything. But in this situation, it's kind of thinking about, it's not helpful to have things right close by that are easy to access, because that just slows down this process of, there was a prompting event, I felt this way, I had an urge to self-harm because I didn't want to feel that way, and then I self-harmed. If we can break some of that between the urge and the actual doing, that can help the young person to work more on this, the way they were feeling about the situation. So other things might help people to feel safer. So one of the main things is that connection with other people, that connection to being able to speak up, to be able to say how things are for them, and to know that that's going to be met with empathy, so real understanding of how that person is feeling, and also validation that, of course, it makes sense. Of course, if you've had an argument with your friend, or you're feeling the stress of exams, or you're looking into the future and things are really difficult for you, then of course you're going to feel unsteady and perhaps pop out of the top of your window of tolerance. So moving on to the light green section of this coping and resilience plan, we're starting to think about what the young person or people around them might be doing in order to support that young person if it seems like they're starting to struggle. And on the left-hand side, there's the things that might be needed in the early stages of someone starting to struggle. And for this young person, they needed the permission to be able to tell people that they were starting to wobble, rather than thinking that it needed to get really, really difficult before they shared it with other people. The young person noticed that activities started falling off if they were beginning to struggle. And at those times, they needed to keep that activity up, starting an activity planner, not just kind of retreating to their bedroom and doing nothing. And they also noticed that they might need to start doing some problem solving about what they might do, how they might respond to some of these problems that were coming up for them, and using other people to help them, to support them to do that before the problems got bigger and bigger and bigger. And on the right-hand side of the green section of this coping and resilience plan, we have what might need to be put in place if things are getting much more difficult, if that person is finding themselves outside of that window of tolerance really frequently. And this is where some environmental changes might need to happen. So where we might put in place a safety plan that says what other people will be doing to keep this young person safe, whether there might be a need for other people to be aware of where harmful objects are or where medications are, where we might be thinking about, does this person need more opportunity to check in with other people? Do people need to know more where this young person is if they're having a lot of urges to harm themselves or suicidal urges? And alongside that, we're thinking about how can that young person deal with their internal world, so that we might write a list of 10 things that this person can do when they're feeling overwhelmed that can help them get back into that window of tolerance. So it's not problem solving at that point, it's just focusing on getting back into the window of tolerance so that problem solving can then happen. So what might be on this list of 10 things that this young person can do to bring themselves back into that window of tolerance? The first thing is possibly distraction. Now, distraction can get overused by people and can be suggested for all sorts of different reasons. Just take your mind off of it, don't think about it, don't worry about it. We've all had those sorts of things said to us. Distraction in this case is to be used in a particular way. So distraction is really helpful if a young person has started ruminating. So the definition of ruminating is trying to think about a problem and trying to solve a problem in your mind that cannot be solved by thinking only. So, for instance, I can give you a problem, 1 + 1 = 2, and you can solve that in your mind. You don't need anything other than your mind to solve it. But when people are ruminating, they're tending to think about things that they can't possibly solve just by thinking about it. These often fall into the category of things that have happened in the past. So we cannot resolve an argument we've had in the past just by thinking over and over and over what was said. We also can't solve the future because we don't know what's going to happen yet. We might be able to plan for the future, but if we just keep thinking over and over, what if this happens, what if this happens, what if this happens, then we can't possibly solve that by thinking. So if this type of thinking is happening, this rumination, this going over and over and over things in a person's head, this can be when distraction is really, really helpful. So when we're distraction, we're bringing our focus back from that thing that we're ruminating on and putting it on something else. So as you can imagine, the quality of the distraction is really, really important. Because if you do something just like watching the TV or listening to music, I don't know about you, but I can fully think about my problems and do those things at the same time. So if we're thinking about quality distraction, they're those things that really take up your thinking that you can get really involved in. So some people might use things like puzzles, crosswords, word searches, Sudoku, all of those sorts of things. Other people might do something that is kind of arts and crafty, but they tend to be things that you get more absorbed into and that time passes without you really noticing it. Also, we might think about distraction with other people. So other people are really helpful at distracting us, of giving us other things to think about. We can hear what that other person has to say, and we're tending to keep on track more with distractions if we're with other people. Then we might think about self-soothing. So we'll be thinking about this as kind of using our senses to feel more regulated. So we've all learned to use senses to regulate ourselves. It's the only thing we had as an infant, as a baby, to be soothed by. So parents might soothe a baby by movement, bouncing them up and down, patting them on the bottom. They might soothe a baby by changing their temperature, kind of taking them into a different environment. They might soothe a baby by making soothing noises to them, or by kind of doing soothing touch. So if we think about soothing a baby, that can give us a bit of an idea of how we might soothe ourselves. How can we use touch, the feel of things? How can we use movement? How can we use drinking, eating, smelling things, hearing things in a way to soothe our nervous system and leave us feeling more regulated again? So things like walking, things like throwing and catching a ball, jumping on a trampoline can be very regulating. Things like strong smells can be very regulating. Cold water, warm drinks are very regulating. But you really need to find out what works for this young person, because we all experience these sensory inputs in different ways. So working with that young person to work out what is soothing to them is really important. Then we'll be moving on to thoughts. So we need to tread carefully with this, because of course a person, if they're in crisis, is going to be feeling overwhelmed. And of course, they have reason to feel how they are feeling. So we don't want to be jumping in with, don't worry about it, the world's a great place really, or it's all rainbows and unicorns. We want to be thinking about how we can validate that person's situation. So often the sorts of things that are affirming and validating for people to hear or to say to themselves are things that acknowledge the struggle. This is a really hard time at the moment, and bring in some sort of kindness or strength or future thinking about things passing and being different in the future. So it might be something like, I'm really, really struggling right now, and I'm doing the best I can to overcome this. Or this situation is really, really painful, and I'm just going to do the best I can and keep going until this pain passes. So they're the sorts of things that are very affirming for people when they're in crisis. We might think of it as validation. You might think of it as self-compassion. And there's all sorts of resources out there to help you think about how to validate and be self-compassionate if you are in a period of crisis. And the final thing we might include in this list of 10 things is body calming. So body calming is a way of producing in the body a drop in blood pressure and a drop in pulse, which leaves the body feeling more chilled. So this is really helpful for counteracting the effects of the stress hormones that someone might have in crisis, and also really helpful for counteracting that kind of can't sit down, don't know what to do, urge after urge after urge to self-harm. Because actually what we know is that self-harm in itself will lead to a drop in pulse and a drop in blood pressure. So it does calm the body, but we're obviously wanting to look for some less harmful ways to do that. So this comes in 4 different ways. The first being changing someone's temperature. This tends to be cooling people down. So if you're in a crisis that is taking you above out of your window of tolerance, then you want to be cooling. So using ice packs on the face, using cold bottles of water on the face, this area in particular being important for that. As long as someone doesn't have any problems with low blood pressure or heart problems or anything like that, then even putting the whole face into cold water can be really soothing and help that body just to bring down the blood pressure and the pulse. Then we have intense exercise. So if you've ever done any intense exercise, you might see that afterwards you feel kind of like this feeling of calm. And what happens is that during exercise your blood pressure and pulse go up because you're exercising, and afterwards it comes down below what it was before you started exercising. So it gives you this feeling of calm. Some people might even feel kind of euphoria after doing some intense exercise. But again, this doesn't mean you have to turn yourself into an Olympic athlete. Even 1 minute of intense exercise, running on the spot, doing jumping jacks, doing burpees, or whatever it is that can bring your blood pressure and pulse up, can have that effect of then bringing your blood pressure and pulse down afterwards. So short moment, minute or so of intense exercise, and you will feel the difference in the body afterwards. Then we go on to paced breathing. So this is where we might use our breathing to manipulate our blood pressure and our pulse. And the way we do this is that we lengthen the out breath. That's the only bit that is really important. It doesn't have to be really complicated. People do suggest that you breathe in, hold for a little, and then breathe out as slowly as possible, and then hold it for a little, and then just breathe in normally, hold it for a little, breathe out as slowly as possible, and then hold it for a little, and go on maybe for 10, 12 breaths like that. And what that does is that when we breathe out, our body naturally slows our pulse. And if we can practice this way of breathing, it helps our body to know how to slow our pulse quicker. And so we can bring on that feeling of calm much quicker as well. And finally, in terms of body calming, we've got this idea of progressive muscle relaxation. So this is when we squeeze our muscles, and by squeezing our muscles, we squeeze out the stress hormones that maybe have accumulated in those muscles. And what I like to do is, after I've had a squeeze, I release and then shake. So shaking is really helpful for moving on the problem, moving on the feelings that we have. And we see this in nature. So if you imagine a David Attenborough documentary, perhaps on the plains of Africa, you might see a scene where some lions have just caught an antelope, let's say. And strangely, if you look into the background, you can still see the herd of antelope. They haven't moved that far away. And this is because antelope eat grass. And grass is a rubbish way of getting nutrients. So antelope pretty much have to eat grass the whole time they are awake. They don't have time for leisure activities. It's just eating. So an antelope needs to move on really, really quickly from a situation that has left them feeling overwhelmed. And of course, if you've got a lion chasing you, you're going to feel overwhelmed. So what they do is to move on really quickly so that they can get back to eating the grass. They shake. So if you look into the background, you'll see the antelope shaking their bodies from one end to the other, shake, shake, shake. And what they're doing is they're getting rid of that build-up of stress hormone that came about when they were feeling overwhelmed and fearful. So this can be really helpful for us as human beings as well. And you might have found that you've been in a situation of anxiety or fear where you've started shaking, and that is your body doing the same thing. So sometimes we find that young people, for whatever reason, are not able to work with us when they are in crisis. Some young people may be fearful of sharing what's going on with them. They may feel that they're going to be judged for the things that they do or the things that they are feeling. They may feel that no one can help, so what's the point in sharing it? Or they may find that they are so overwhelmed that their motivation to get back into that window of tolerance is not there. And so we might have a young person who doesn't want to learn how to do these things to re-regulate, that doesn't want to think about ways of well-being. And at those times we might have to start planning on the young person's behalf. So in this coping and resilience plan, we have a section for planning ahead for that. And trying to keep the young person as involved as possible when decisions are being made on their behalf. So things like really explaining why you've made the decisions that you've made. Knowing some of the things that the young person wants to avoid. So on this one, this young person wanted to avoid going into hospital and working as hard as you can to avoid that happening. They may find that you just need to keep going back to them and back to them and back to them, because the way they feel about being involved may change over time. So it's not a you're either in or you're out, but that we just keep trying to keep that young person involved as much as possible whilst working on their behalf and working in the environment to maintain safety as best as possible. So to finish off, I just wanted to draw your attention to a particular part of the Hampshire CAMHS website, which is the Help I'm in Crisis button. So this button is really helpful for young people, parents, professionals to use, just to help guide you through what to do if someone is in crisis. So it works as a bit of a flow chart, which is really helpful because, as we know, people are going to find it really hard to problem solve when they're in crisis. And it just takes you through a list of decisions to help you think about what to do next. So if you find yourself in crisis, I would really recommend using that button. So I'm hoping you found this presentation helpful and that you feel that you've had a better understanding of what a crisis might be for young people and how you might be able to support that young person whilst they're in a crisis. If you need more information about crisis or any other part of mental health difficulties, please go to the Hampshire CAMHS website.